Hi, good morning, or rather good afternoon. It's 1 p.m. here. And before I dash off to pick up my son, let's quickly solve another of Australian Dental Council exam questions, written one. And before I start, I'll just raise this topic once more because I got 3 messages in the morning from 3 different candidates, new ones, who said that please provide us all the dental materials. We are ready to get enrolled in your course and really want to clear the exam in one shot, and we are very anxious about it. This is the same voice note that I have left for all 3 of them, and which I'm saying to all the new candidates and the existing ones: please do not be anxious. ADC is a journey. The passing percentage is less than 20 in part 1, less than 2% in part 2 exam. Today morning I received a message of a different candidate who's given 3 times his practical exam. Wow, that's a lot of expense because each practical exam costs you like $5,000 to $6,000 US dollars. I'm talking about, not the Australian dollars. Australian dollar cost is 6,000 plus the material cost, the traveling cost, the coaching cost, etc. amounts to 5 to 6 US dollars, thousand. Okay, and he's appeared practical exam thrice. He's exhausted his limit, and now he has to appear again for the written exam, pass that, and then again go back to the practical exam. Appearing a practical exam 3 times means at least 2 years gone, and you can appear for the practical only after you clear the written. So assuming you clear the written in first attempt, and after that you have appeared for the practical after 6 months of it and then gave it thrice, that means 2 to 3 years gone, and now you're back to square one. And this is not a story of just one candidate, it's of many numerous ones, only that people don't come out with it because they feel embarrassed. But there is nothing to be embarrassed about. It's not you have failed, you are just fine. It's a money making exam, just remember that. So do not aim to get stressed, and do not aim to not fail the exam. Yes, you should aim to pass, but you should do so with a relaxed mind. If you're going to stress yourself about it, as it is the exam is tough, as it is the result criteria is not so transparent, it is corrupted, there are unmarked questions, there are tricky questions. If you clear in first attempt, great. If not, don't be disheartened. If ADC is your goal, just stick to it. Just keep attempting, keep lots of money in your hand, and just keep attempting and attempting and attempting. That's it. So having said this, let's just go ahead and solve this question. Again, focus on the keywords. Change the attitude in your mind when you read the question. Mostly, very few questions will be direct. 99% of them would be a trap, and there'll be similar options, and you have to choose the best one out of it. Okay, so you should know what you're looking for. So a 11-year-old girl presented to your clinic with her mom. 11. I know it's a pedo question. For a general dentist, pedo, prostho, perio are a bit pain. I understand, and pedo questions can get tricky because here it's not just pure pedo, sometimes it comes in the criteria of interceptive orthodontics, and interceptive orthodontics is one thing which you just don't study well as a BDS graduate, and I get that, but you need to study more about it. So if you have such questions, you should open your textbook, read more on interceptive orthodontics, keep brushing it up. You may not have read it during your BDS, do it now. So anyways, a 11-year-old girl presented at your clinic with her mom, and when she stepped into the clinic, you noticed her teeth. So this is how the smile was. The mom has concern about the non-erupted one too. Now just imagine this is a deciduous tooth, okay? I mean, this is the picture that I could get. Of course, I won't get the exact picture from the exam, but imagine the bite is exactly like this, but this tooth is a deciduous tooth and not a permanent tooth. Now she thinks that this is odd and came in for an examination and explanation. So this girl probably had all the permanent teeth and two, but 1 2 is not there, and it's a milk tooth here. Now the mother is worried that she's 11. How come this lateral incisor has not erupted but this has? And it's a very rightful concern because the age of lateral eruption is between 8 to 9. and especially so when one tooth is erupted on the other side but the contralateral has not. That means some problem is going on, okay? And that is irrespective of the age. Even at the age of 10, if the patient came with a non-wobbly 1-2 and 2-2 has already erupted, you should still get suspicious. You should not say, okay, it's a milk tooth, it's gonna fall off. No. If one is there in the mouth and it's been more than 6 months since the other one has come out, you should immediately take an x-ray and be very, very concerned about it. Now this is applicable to all the teeth in the mouth, okay, regardless of the age. But here more so because she's already 11. Now what will you do about the patient concern? Tell her that it is normal for 2 to 3 erupt to erupt before 1-2. Refer her to an orthodontist directly. First take an x-ray, please. Tell her that nothing is abnormal. That's a very false statement. Do clinical and radiographic examination. Tell her that lateral looks missing as long as it has not erupted. You cannot term it as missing unless you have taken the x-ray, right? So first you'll do clinical and radiographical examination. Check for any bulges, check if it's erupted palatally. Do a radiographic examination to check if it's there inside, it's not there inside, what is exactly happening. Only once you have a proper radiograph and you determine the cause, then only you can refer to the orthodontist or an oral surgeon, whichever is appropriate. You understand that? So D is the right answer. What is your obvious finding on clinical presentation of girl? Now, this is the clinical presentation. The obvious finding here is the bite. It's a very, very deep bite. So this is the answer. Now, what is the suggested treatment to fix the condition in question 2 if the patient presented at the age of primary dentition? Now, a very specific question and it will have a very specific answer. What is the suggested treatment to fix the condition in question 2? Now here, if you would have chosen anything else apart from deep bite, not only would you have marked this question wrong, you would mark this question wrong as well. You understand? So question number 3 is an extension of question number 2 and it depends on the answer that you chose for question number 2. So since I chose deep bite, now what this question number 3 is asking, if the patient would have come with deep bite at the age of a primary dentition, what would you do? Okay, now this is a kind of a little tricky question because I do know in primary dentition all the textbooks say that deep bite is one of the self-correcting malocclusions. But then again, it also depends a little bit on the degree of deep bite. A very severe deep bite, you can actually give an activator or a Hawley's retainer with a bite plate. That is a very, very acceptable treatment, okay? So here when I have the options, a removable ortho appliance to rearrange the teeth, no. Fixed ortho appliance to rearrange the teeth, no. The teeth is not the problem, it's the jaw. Activate the type of appliance, no treatment is required. And there is no option 5. So some people might say it's option D and some people might say it's an option C. I would say it depends on the degree of the deep bite that is presented in the question. If it's a mild deep bite where you can actually see a little bit of lower incisors, probably in primary dentition you can choose the answer, no treatment is required. But if it's a massive, massive deep bite, like for example shown in this question, where you just cannot see the lower incisors and the upper incisors are kind of hitting the lower gums, and imagine the same scenario in the primary dentition, and that too at a specific age, age 5, I can give an appliance. Can I give the appliance at age 3 and 4? No. In that scenario, I would choose no treatment. So it also depends. Now this question is very specific, but they haven't given the age. So depending on the clinical scenario and the age, if they mention of the primary dentition, you have to choose your answer. But at the moment, you can have a reasonable doubt of choosing option D. So C and D technically are correct, but I have chosen option C in this, seeing the degree and severity of the deep bite. But even if you think, no, I'll go with option D because it's mentioned in the textbooks, you can go with that. It's not a wrong option. Now the mother called 3 to 5 days later and claims that her daughter developed an allergy to latex. what would you do? It's been 3 to 5 days later that the lady's calling, so it's kind of a delayed reaction. Tell her that latest allergy would not occur after 4 days and use latex gloves. Refer her to an allergy specialist to test for allergy. Use latex-free gloves and refer to immunologist. Refuse to see her as environmental exposure to latex is potentially critical. Abandon any treatment until allergy tests are concluded. Okay, a little, complicated question. See, firstly, the mother is calling you after 3 to 5 days. She's not present in the clinic. So, option C, option D, and option E are not applicable here because she is not present in the clinic. Option A is not wrong, but there are incidences of delayed reaction. Okay, now it may not be so common, but you cannot just invalidate the patient's claim. But you also don't know what the allergy is about, because the mother does say that she has got some allergy. She assumes it's because of the latex. You don't know it's because of the latex, but there is an allergy. So who's going to confirm what that allergic reaction is? It's an allergic specialist. Correct? So hence that becomes the answer. Many people would just immediately mark option C, but you don't really know if it's latex allergy, because if that would have happened, it would have happened immediately in the clinic itself. You understand? So if it's a delayed one, she may have eaten anything, she may have gotten exposed to anything. You have no idea. Do not assume the patient's words to be correct. Yes, it's a fact there is an allergy, but it's an assumption it's because of latex. So let the allergic specialist confirm that. And if it does get confirmed that it's latex, you document that in your notes. And when the patient comes next, use a latex-free glove. Simple as that. Understood? Now, if the girl developed urticaria while you were examining her, now it's a hypothetical scenario which they have presented, you will give what? Urticaria is rashes. You're itching, but you are conscious, you're breathing, there is no swelling. If there is no breathing issues, there is no swelling issues, everything else is fine, only itching has started, you are not going to call an ambulance. There is no need for adrenaline. There is no need for an intramuscular steroid. Oral antihistaminics are just enough because the patient is conscious, vitals are stable. Just treat orally. If the patient developed some sort of anaphylactic reactions, call an ambulance, give an adrenaline. Understood? So, yeah, this is what it is. And what I want you to do after you have watched this video is to write down, please. Read more on deep bites, open bites, cross bites, class 2 malocclusion, how it looks, methods to treat it. Class 3 malocclusion, how it looks, methods to treat it, and eruption chart. Many people just do not try and remember the eruption chart because it's too much of a work for them. Please write it down daily. Please, please, please. And when I say eruption chart, I want you to remember when the first tooth starts forming, when the first calcification starts happening, eruption age of the deciduous teeth. I know it's a pain, but you have to do it. Eruption age of the permanent teeth. I want you to write all this, please. So I want you to read all these topics in detail. Let 2 hours go by. Open your orthodontic textbooks and please do so. If you feel bored reading the textbook, go to slideshare.net, write type 1 malocclusion, type 2 malocclusion, type 3 malocclusion, or even more better, just type a presentation on interceptive orthodontics, then go through the eruption charts like I had mentioned on your dashboard. Eruption chart and the periodontal chart and the fluoride chart and the chart of antibiotic prophylaxis should always be there. Morning and evening, consider that as your prayers and go through it. Questions will 100% be asked on that, and do not make a silly mistake because you forgot the numbers. You understand that? So here are the golden words. Go ahead, read, pause, practice, watch video, and see you next time. Bye-bye.